When taking Lialda, be sure to take it with a meal as directed by your doctor, usually once daily. Swallow the medication whole, without crushing, chewing, or breaking the tablets, as this can affect how the drug is released into the colon. It's important to drink plenty of fluids while taking Lialda, unless your doctor advises otherwise, as this can help prevent kidney stones. The dosage of Lialda is based on your medical condition and how you respond to treatment. For children, the dosage is also based on their weight. To get the most benefit from Lialda, it's important to use it regularly. Try to take it at the same time each day to help you remember. If your condition does not improve or gets worse, be sure to inform your doctor. Some common side effects of Lialda may include headaches or abdominal pain. If these effects persist or worsen, it's important to notify your doctor or pharmacist right away. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks. Many people who use this medication do not experience serious side effects. In rare cases, mesalamine can worsen ulcerative colitis. If you notice your symptoms worsening after starting this medication, such as increased abdominal pain, cramping, or bloody diarrhea, it's important to inform your doctor immediately. You should also contact your doctor right away if you experience any serious side effects, including nausea or vomiting that doesn't stop, signs of kidney problems, dark urine, severe stomach or abdominal pain, yellowing of the eyes or skin, chest pain, or shortness of breath. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice symptoms such as fever, swollen lymph nodes, rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of potential side effects, so if you notice any other effects not listed here, be sure to contact your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice about side effects or report them to the FDA. In Canada, you can also call your doctor for medical advice about side effects or report them to Health Canada. Before taking Lialda, it's important to discuss any allergies with your doctor or pharmacist. This medication may also contain inactive ingredients that could cause allergic reactions or other issues. It's also important to inform your doctor or pharmacist about your medical history, especially if you have kidney disease, liver disease, or stomach blockage. Lialda may make you more sensitive to the sun, so it's important to limit your time outdoors and use sunscreen and protective clothing. It's also recommended to avoid tanning booths and sun lamps. Before undergoing surgery, make sure to inform your doctor or dentist about all the medications and products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, discuss the risks and benefits of taking Lialda with your doctor. Similarly, if you are breastfeeding, consult your doctor before taking this medication. When taking Lialda, it's important to be aware of any potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's best to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Before making any changes to your medication dosage, always seek the approval of your doctor. Lialda contains mesalamine, which is similar to other medications like balsalazide, alsalazine, and sulfasalazine. It's important not to use medications containing these ingredients while using Lialda. It's also important to note that Lialda may interfere with certain lab tests, potentially causing false test results. It's crucial to inform lab personnel and all your doctors that you are taking this medication. In terms of dosage, Lialda is typically taken once daily, usually with a meal. It's important to follow your doctor's instructions and take the medication at the same time each day for the best results. If someone has taken too much Lialda and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call 911 or the local poison control center at 1-800-222-1222. Canadian residents can reach out to their provincial poison control center. Symptoms of overdose may include ringing in the ears, confusion, rapid breathing, and seizures. It's important to take Lialda exactly as prescribed by your doctor and not to exceed the recommended dosage. Remember to always follow your doctor's instructions and consult with them if you have any concerns about your medication. It's important not to share Lialda with others, as it is prescribed specifically for you based on your medical condition. Before starting and during the course of taking Lialda, your doctor may recommend lab or medical tests to monitor your liver and kidney function. It's important to keep all of your medical and lab appointments and consult your doctor for more details on these tests. If you happen to forget a dose of Lialda, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose as scheduled. Do not take a double dose to make up for the missed one. It's important to stick to your regular dosing schedule to get the most benefit from the medication. It is important to store Lialda at room temperature, away from light and moisture, and not in the bathroom. Keep it out of reach of children and pets. Do not flush Lialda down the toilet or pour it into a drain unless instructed to do so. When the medication is expired or no longer needed, consult your pharmacist or local waste disposal company for proper disposal. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.